My name is Ghadir A Sayed, teaching assistant in the Faculty of Pharmacy, Egyptian National University. My study is about mitochondrial DNA and fresh versus frozen embryo culture media of polycystic ovarian syndrome patients undergoing in vitro fertilization, a possible predictive marker of a successful pregnancy. Frozen embryos transfer may improve the live birth and reduce rates of ovarian hyperstimulation in polycystic ovary syndrome patients. Morphological criteria are the classical way for embryo selection, yet recently many biochemical and genetic markers have been developed. This study aimed to compare fresh and frozen embryo transfer using the mitochondrial genomic DNA ratio of embryo secretome and the possibility of using this ratio as a predictive marker of PCOS pregnancy outcome. 100 PCOS patients undergoing IVF were chosen according to Rotterdam criteria and divided into two groups. Group 1 including 50 patients with fresh embryo transfer, Group 2 including 50 patients with frozen embryo transfer, and otherwise 33 apparently healthy women with a control group with fresh embryo transfer. We then carried out absolute quantification of embryo culture media of mitochondrial DNA and genomic DNA by real-time PCR. Mitochondrial genomic DNA ratio was significantly low in PCOS embryo culture media in comparison with control. Additionally, the mitochondrial genomic DNA ratio was significantly high in pregnant PCOS embryo culture media than non-pregnant group. Mitochondrial genomic DNA ratio was high though not statistically significant in the fresh embryo transfers and frozen embryo transfer group. Also, this ratio with sensitivity and specificity in PCOS embryo culture media as a predictive value of pregnancy outcome were 86% and 96% respectively. Conclusion: Mitochondrial genomic DNA ratio measurement in PCOS embryo culture media is a novel marker that can be clinically applied as a predictive value of the quality of the morphologically good embryo.